Hey, everybody. Welcome to the Horse Geeks podcast, where we look at horses and riders from the inside out. I am Kirsten Nelsen, professional horse trainer, founder of Training for Optimal Balance. And with me is Deb Romero, certified Alexander Technique instructor. And I just dropped my word, massage therapist, orthopedic massage therapist, so medical massage therapist. And what we wanted to discuss today was to tie together a few topics we've been talking about, which are biomechanics and the laws of motion. So biomechanics, we'll explain that a little bit, how we generate and manage forces of motion and how that relates to the biomechanics. And then thirdly, how we perceive that. So that's kind of what we want to touch on today. And try to pull some of these ideas we've talked about together, make them a little more practical when we actually go out walking around the planet or riding our horses. Okay, so I think we'll start off with what is biomechanics, because some people don't understand what that is. It's a new sort of buzzword in the industry. When people talk about biomechanics, or the other word that means the same thing is functional anatomy. And my best understanding of it is that a body, an equine, has a specific structure, has a skeletal structure, muscles, bones, tendons, ligaments. All of that structure is the mechanism of the body. So, and same for us. What makes us human is the shape of our skeleton, how our body parts fit together, where everything's located. So anatomy, that's why all doctors can work on people, even though a unique body will have specific anomalies. Most human bodies basically have the same inherent structure. Most horse bodies have the same inherent structure. That's the mechanical structure that we're just born with. So biomechanics is looking at the body as a machine and saying this machine has ideal ways of functioning and less ideal ways of functioning, just like a car engine or a bike or any other mechanical device. And do you want to add to that, Deb? Like, what's your take on biomechanics, or how would you explain it to somebody who's never heard of it?
Yeah, it what you said is true. It's the structure, how it moves, and actually other parts of it could be all the way down to the cellular level. It could be a study of muscle fiber filaments, and how they work. Or I know you told a story about being on a plane with some athletes. Were they triathletes? And
Um,
or they
Iron
were
Man.
Ironman guys,
Mm-hmm.
and how they're getting into this type of information in sports world to maximize their use and minimize the amount of energy it takes to do that.
Absolutely. It's a big thing with performance sports across the board. It's less known in the horse industry. It's very well known for human athletes, in that our body's structure, or the inherent mechanical design, there are specific body parts designed for specific functions. So in other words, our ball and socket joint in our shoulder is designed in a way that isn't great for weight bearing, but provides a spectacular range of motion, right? And then our hip joint, which is another ball and socket joint, is a different type of ball and socket, a different construction, even though it's technically the same type of joint. The construction of it is a deeper socket and sort of a different shaped ball, because it has the function of weight bearing as well as range of motion or mobility. So a ball and socket joint is going to have greater mobility than a hinge joint like our knee, right? So twisting our knee creates a lot of pain, where we can do the splits if we're limber without damaging our body. That's a difference in the construction of the joints. And so biomechanics is the study of that, and saying if we work within a specific range of motion, we maximize strength, we maximize even our metabolic rate. So we spend less energy when we use the machine appropriately, and
Yes.
we reduce the risk of injury. We can even recover from injury. That's what physical therapy is restoring mechanical function to the body after it's been injured or you've had surgery or something like that. And it's interesting, like even for people, that we have physical therapy, because when we have an injury or surgery or trauma to the body, the nervous system of the body sets up a detour to promote healing of a specific area. So our nervous system says, don't use that part. And pain tells us, don't use it that much or don't use it at all.
Don't
So
use it that way.
or don't use it that way. And so the nervous system is sort of monitoring the use of the body, right? And so what can happen is, say, after even a minor surgery, the nervous system automatically sets up a detour so that body part can rest and heal. But then once it's healed, that detour stays in place. The nervous system can sort of forget to go out and take down the detour cones and signs, and it just becomes a permanent detour. Unless we go back and consciously, with awareness, restore the healthy range of motion and remind the nervous system there's no longer pain there. We can use this body part again.
Yeah, I think it's real important what you said about it. It has to be a conscious effort
Yes.
to make the change, because subconsciously the change isn't going to happen. We don't go back to our old way of moving after any kind of injury, a trauma. So yeah, and having another person help with that, I think, is also a critical part.
Yeah, and
I don't know if we can do it ourselves. I really don't.
And that we'll talk about that today too, how we sense our balance in time and space. It involves the eyes, the inner ears, and what we call proprioceptors throughout our entire muscular skeletal system.
Yes.
And so anytime the nervous system reroutes around an injury or a trauma, if we don't reactivate the nervous system and remind the nervous system, then our powerful brains, or even a horse's brain, any nervous system just sort of goes, don't use it. And that can become a permanent lack of use, right? We have to literally go back and sort of show the nervous system that we can have this range of motion in that specific mechanical function without pain, for the nervous system to incorporate it back into the body.
Yes.
Yeah, so mechanics, biomechanics, or functional anatomy teaches us, it's sort of that form function connection, that the design of the body in each of its parts tells us the intended use of the body part, right? So if we're walking around on our arms all the time, that's not the intended use of that apparatus, right? So we crawl as little, and then we're toddlers where we fall a lot, but we learn to walk innately. And structurally, our body requires that we learn to walk, or we would damage our upper bodies significantly. It's not meant for that kind of weight bearing and wear and tear.
Exactly.
Right. And with horses as quadrupeds, it's hard for people to understand sometimes that they can be mechanically severely malfunctioning, but they're not actually losing their balance or falling over. And I go, that's
so
the
say
bit.
that again. Say that again.
They can have the same issues that we're describing with humans and physical therapies. So if they injure a leg or injure a hoof, the nervous system can set up to sort of say, don't use that leg. And because they have four, they can minimize the use of certain legs and maximize the use of others. And in their natural shape as a quadruped, they have to have far greater significant failures of the system to actually fall over or stumble,
Do you
because
think that
they've
they
got four
also,
legs.
yeah, that maybe with our eyes anyway, something could be going on and they could be masking it
Yes, because
until we can
also,
see it, shall we say, until the human can say or feel it or however, like, oh, my horse is lame today. But could there have been a dysfunction in biomechanics that started long before that, before we
yes.
visualize a problem?
Yeah. So in veterinary medicine, there's two types of lamenesses. There's what's called mechanical lameness, which means the mechanics of the body are dysfunctional. They're not near ideal function. That could be the spine, the legs, axial skeleton, any, or the whole body. So mechanical lameness can be going on a very long time before we get to the second type of lameness, which is called a painful lameness.
Okay.
So a painful lameness is what the vet comes and does the flexion tests and grades with visual deviation of movement, right? So by the time the human eye as natural predators can see lameness, which is a deviation of normal movement, that's considered a painful lameness. And it's considered a painful lameness because the body can no longer mask the dysfunction. So mechanical lameness can be happening for years without a visual deviation created by a pain issue. It doesn't mean that there's not pain with mechanical lameness. There can be a lot of discomfort, but we're not seeing a deviation in movement. And this is one of the trickiest parts with biomechanics with horses, is because as prey animals, showing deviation of movement is what attracts the eye of the predator, right? So when a predator sees a deviation of movement, they know that's the weakest member of the herd, which will be the easiest to catch and eat, right? So horses evolved by masking mechanical dysfunction in lots of creative and complex ways. So we don't see, by the time we see a grade 1 lameness with the vet, we could have had significant mechanical lameness that went on for years.
Wow. And I think that applies to people too.
It's why we get arthritis, around 40, 50 years old. We all start to have arthritis from mechanical lameness or mechanical less than optimal use. And that's why you and I use the word optimal. I do training for optimal balance, which is horse and rider, and you do optimal posture, which is for all people and riders. But it's to retrain the nervous system towards a mechanical use that, we're not born with a handbook of how to use ourselves. We just kind of all figure it out. So we all function, but that doesn't mean we're functioning in the most optimal use of our mechanics, which creates mechanical lameness, it can create excessive force in a joint, on a tendon, on a ligament, chronic muscle overcontraction or use, pain issues, bone spurs, arthritis, that kind of stuff, just from small repetitive misuse of the body mechanics.
Yes.
So that's the importance of mechanics. That's the structural part. And then what we've been talking about in the past couple podcasts are the forces related to movement. So the forces are the intangible sort of part that we can't see and wrap our hands around and manipulate exactly, but we feel them. They're very tangible. We generate force and we manage forces with our bodies. We do both.
Yes.
So from your perspective, like we have these three laws of motion. We have inertia, we have force equals mass times acceleration, and then we have how forces interact. in opposing directions and equal in magnitude. Those are Newton's laws of motion. So can you talk a little bit about how the body goes about generating forces? Because here's the machine, and we don't go to the gas station. We put food in our mouth that gives us, right, the fuel, right? That's like going and putting fuel in your car. But how does the body generate force to initiate movement?
Well, I think what you hit on that is key. You said a little while about even about changing the body, the mechanics, is it all begins with a thought. And we probably aren't conscious of that, but if I am going into another room, that the thought goes to the program and says, oh, you've got to do A, B, C, D to get there.
So the thought is the force initiating the movement. That's the key in the ignition, so to speak.
Exactly.
Okay. And then how does it move?
Then we pretty much have operating systems, if you want to call them that. We pre-programmed ways to do it.
Well, that's what we're learning as toddlers and young children,
Yeah.
is as we're learning to move with our bodies, especially on 12 and younger, we're developing those programs for movement called pick up a cup, eat with a fork, ride a bike, sit down, stand up, move around. That's where we're developing that software program, so to speak.
Right. And it comes from everywhere. It can come from role modeling. I don't know if people realize how much children are watching how we use our bodies.
So part of it's mimicking, like
it's
just
mimic. Yeah.
Interesting. Yeah. And so basically, like Newton's third law of motion, I think best explains sort of how forces in the body interact to generate movement. So for every action, there's an equal and opposite reaction. So the bones move one way, the muscles exert force in the opposite direction, but equal in magnitude. And that sort of propels the body. So we have these soft tissues and hard tissues that act sort of in an opposing way that generates movement.
Exactly. So the opposite of that, if it's hard to grasp that concept, is if you see, say, an athlete running, I can always get this in my mind, and they pull a hamstring or they're grabbing the back of the leg. So that's when the law of biomechanics is not going well.
That's when you have a mechanical failure.
Yeah. Yes. So, and that is usually because the muscles on the front of the leg, the quads, have not let go when the hamstrings are being activated to push. And the quads are much stronger than the hamstrings. So the quads are going to win out.
So if the quads are perpetually tight, if it's not this interplay of forces,
exactly,
that's what sort of pulls a muscle, and it'll be the weaker of the two muscles.
Something's gonna let go.
Got it.
So the whole body functions on that law of opposing forces. Say, the bicep shortens, but the tricep on the back has to be lengthening for that to happen, and vice versa.
Right. And that's how we move the bones.
Right.
Yeah. So the muscle use is sort of the acceleration factor, and the bones are sort of the mass factor, the size, the shape, the weight, the density is sort of the mass of our body. And then the forces are in how we accelerate and work with opposing muscles and soft tissue.
And then I consider the joints kind of like the levers.
So then what about force management? Like, for instance, when I work with riders on horses, the horse internally is generating all those forces in order to move. And it's directly related to the function of the mechanics. So what I find is if the mechanics, when they're operating closer to an optimal mechanical use, then the forces that are generated are smoother, more organized, more cohesive into specific directions, and not so all over the place. So we feel the mechanical use through force management, or how forces sort of direct. Does that make sense?
Yeah, and the way the ease of it, when it's closer to optimum, less energy is being used at that
Right.
optimum. You know, it's much harder to manage a force that's all over the place than a force that is still.
Right. And so, like, even Newton's third law of motion talks about this static equilibrium in these opposing forces. And that, to me, is the most accurate description of balance. So to kind of connect the mechanics to the forces that we feel when we ride, if a horse goes into spinal extension, where the spine is pushing downward, it always has the side effect of mechanical hyperrotation. So you get rotation is sort of a side to side twisting motion, and extension is a downward force of the spine, which makes the horse elevate the head and neck, and it puts the body on high alert, where the body is momentarily being stabilized muscularly. Right. But it has a destabilizing effect on the skeletal use. Right. So the skeleton can move, but the muscles are doing the primary job of fight and flight. And so when a horse is ridden in extension, what we feel is a whole lot of side to side force.
Rocking the boat.
Yes, and that's the side effect of the downward force of the spine. But that side to side rocking speaks to a dysfunctional use of the spine. Right. And they can also have too much lateral bending, where, the spine is so mobile that the forces generated internally by the horse are sort of shaking the rider side to side, or making the rider's pelvis uneven, unlevel, the legs unlevel. All of those are forces that are generated by the mechanical use of the horse, right? That challenge us as riders. So a horse that's smooth and easy to ride is also telling us that the mechanical use of the horse's body is getting better. And when we say a horse has a bad trot or a bumpy canter or bad gaits, what we're really saying is we have mechanical malfunction, mechanical lameness, that eventually over time could lead to a painful lameness and deviation of movement.
Yes.
Yeah. And then as riders, when we think about, because also the whole biomechanics is a study unto itself. But if we don't relate forces to biomechanics, as riders, we get on horses and we sort of give an aid, which means we're adding a resisting force, right? We're generating force from our body to resist something that the horse is doing that we don't want. That's what an aid is. And a lot of us think we initiate the force of an aid. So a leg aid, we swing our lower leg into the horse's barrel in order to move the rib cage. So we're generating the force to move body parts.
Does that work?
Not usually, not very well. Yeah. So then we go, oh, I need a spur because these body parts are not moving. Right. But if we actually are managing forces, I go, the rider can't get away from the forces that are being generated by the horse's movement. I don't care what saddle you're in or what kind of riding you do. We all succumb to the forces of the horse's mechanical use internally. So as riders, when we think of balancing, if we don't initiate the force of an aid, then we're better at resisting kind of multiple directions of forces that are generated by the misuse of the horse's mechanical body. And it sounds like such a small difference, but it makes a huge difference when we ride to ask ourselves the question, because both bodies are capable of generating forces and managing forces that are already generated by something else, right? So as riders, when we learn to use our bodies as resistant rather than generators of force, we can resist all over our body all of these forces that are going somewhere other than straight and forward and upward. So if there's too much side to side dissipation of force, which is related to a mechanical spinal function, we can resist all those forces to improve the mechanical function and have an easier horse to ride.
Yes.
So that's how the mechanics and the force management tie together. Right? But we think as riders that we initiate the force on the bit or the reins, we initiate the leg force, we initiate the seat force, and then we can't receive, we can't feel.
That's a really good point.
Yeah, we don't know what the horse is doing because we're busy generating force.
Mm-hmm.
Which sort of leads into our third part of this discussion, which is proprioception or kinesia, which are the senses in our nervous system that signal body motion transmission of forces across a chain. So it's often called our sixth sense. It's part of our sense of touch, but in all of our muscles and tendons and ligaments and joints, we have neurons. I think I wrote it down. Yeah, mechanosensory neurons, right? In the muscle spindles, in the, I'm going to say this wrong, Golgi tendon
Golgi
organs.
tendon reflex. Yeah.
Okay, I did say that right.
Mhm.
And in the joint receptors. So it's a sum of neural information that sort of tells us where we are in time and space. So if we're generating forces with our body in the aids, we can't be receiving the forces generated by the horse's body at the same time. Our proprioception is going to pick up our own body more than any outside force.
Exactly. And keeping it simple, if you are, say, using a muscle contraction to generate the force, those proprioceptors are shut down in the body and will not receive any information from your own body.
Oh, so as you add tension or contraction, and does it matter what type of tension or contraction? I mean, tension or contraction is possible in all types of muscle use. So there's concentric, which is a shortening of the muscle fibers, and there's eccentric, which is a lengthening of the muscle fibers, which we've talked about before. So it doesn't make a difference whether it's eccentric or concentric. You're saying
more the concentric, because it's a shortening, which really shuts off the joints. You know, the joints aren't able to be used then in a lengthening situation.
So concentric is drawing the body inward,
right,
which is stimulating the nervous system sort of on an internal loop of information, what's going on inside. And then eccentric gives us the ability to resist, but because it sort of expands the mobility, eccentric is more of an outward expansion of the body, which is going to give us more range of motion in our joints and more possible information coming into the body through the tendon, ligament, joint system and muscles.
And it actually creates more force than a concentric contraction.
So a lengthening of the muscle creates more, generates more force in magnitude, you're saying?
Yes.
Yeah, because it's a different direction. So an eccentric contraction is a lengthening, a concentric is a shortening, and that directional change also affects the power factor or the amount of force.
Right. And as a bodybuilder, this language may help. We call it a negative contraction, a negative roll. So that would be if you were taking your bicep, concentric is shortening the joint, bringing it up, but a negative rep, as we call it in bodybuilding, would be lowering the weight.
Slowly.
So I'm slowly, and I'm lengthening that muscle, but it's still contracting.
Right. Right. So the force is equal, but you're working both directions of like the range of motion of the muscle.
Exactly.
Yeah. And then, so proprioception, if we talk about how we perceive our body in motion or how we sense balance, proprioception are sort of the neurons in our nervous system that tell us where our muscles, tendons, joints, ligaments are in space and how they're working. But then in our eyes, we have a strong sense of balance ocularly. If our eyes are unlevel, we cannot balance. And then in our inner ear, we have the vestibular, it's like a fluid system,
It's the
right?
vestibular apparatus.
The vestibular apparatus, where we have inner ear fluid. And if that gets out of balance, it can actually throw off our whole body. Mm-hmm. So with riders, a lot of times we don't realize that we're in poor function or poor balance or not able to manage forces accurately, because if our head is straight, that's a stronger sense of balance than the proprioception that's available through our muscles. And both are available, but once our head is straight, if our eyeballs and our inner ears are happy, that's a huge part of our sort of sense of balance. It doesn't mean like our inner ear fluid and our ocular sensation of being level can occur in complete mechanical dysfunction. And that can override the brain's sense of balance while the body sort of manages and does its best to carry around the head. But what that leads to is mechanical wear and tear, mismanagement of forces, inefficiency, small wear and tear over time that leads to pain issue and breakdown of the mechanical system. So listening to the proprioception in our body, I think when we're young, we're very tapped into that sort of proprioception in the body as part of our balance, because we're growing and changing physically while the bones are still growing. It's like that dynamic of knowing where our torso and our arms and legs are in space is changing every day.
Yeah, and it's great that you brought that up, because when we were talking about what initiates movement, it's the thought. And the older we get, the more we have what we consider pre-programmed ways.
Right. So once it's pre-programmed, we can ignore or train our brain to ignore the nervous system input from the body, which is
until, like you said, we have a warning.
Pain. Hammy.
But when we're younger, that we're still experimenting and exploring.
Well, and that's where proprioception is in our bodies. Mm-hmm. We're very tapped into it because we're building the software programs that we use the rest of our life. And the good news is we can go back and rewrite the software programs, right? Because we don't have a manual of how to move when we're born, and we all just sort of figure it out through movement. So if we want to move better, even very talented athletic people can sort of tap back into that proprioception in their body, sense of balance, and a deeper understanding of mechanical function to improve the way they move, which literally gives you faster times, more athletic ability, less risk of injury. So that's the benefit for any athlete, whether it's a human or an equine. It's the same idea.
Yeah, and like you were saying, we kind of, as we age, allow visual to overtake the kinesthetic sense.
Mm.
We become much more audible and visual as adults instead of going into the intrinsic working of proprioceptums and where we are in time and space.
I think there's also a mechanical reason in the VOR, which is the vestibular ocular reflex. And it's one of the fastest reflexes in the body and is directly related to our sense of balance. So if we have an inner ear infection, it can affect vision. And if we have vision issues, it can affect our sense of balance vestibularly. And so that powerful, I think we rely on it the older we get.
I
But
totally
it's
agree.
so quick and powerful, right? So we can't get away from it, but we can reawaken the proprioception system in the, the muscles, the joints, the tendons, and ligaments to update our software, give ourselves a software update as to how to run the mechanics and overcome what we call habits of movement. So what you're talking about with these software programs we're developing at a young age, those become the habits of movement that
Yes.
we just run that software program. And as long as that VOR is happy, we're good to go.
We're
We don't,
good.
yeah, we don't think about it too much. And
Um,
when I work with riders, like, well, it's true for horses and riders. Horses handle it a bit better because they sense the ease of emotion without any complication of judgment or imagination, right?
right.
I think for humans working with riders, sometimes a very positive change that brings the body a lot of ease can disrupt this sort of VOR or this
Mm-hmm.
sense of balance, or it kind of runs a red flag on your software program going, this is not correct. This is not correct. And
I've had that. Mm-hmm.
our powerful brains quickly give it a value judgment, right? So we label it as
Yeah.
wrong because it's unfamiliar.
It's disruptive,
It's,
unfamiliar. Yeah. I've had
yes.
people that have had, kind of the really forward chin posture, have them learn how to manage their head neck relationship, and they will actually go into like a vertigo type
Disoriented.
situation. They get very
Yes.
disoriented because that's not the place they've been functioning from. So, yeah.
Right. So a lot of neck issues like discs in the back of the neck or neck pain, even some shoulder pain can be directly related to just how we balance our
Mm-hmm.
skull on the cervical vertebra,
Yes.
which is also going to change how the fluid stabilizes in the
Mm-hmm.
ear and how we use our eyes. So that makes sense that a mechanical change in that relationship between the skull and the cervical spine could suddenly give you massive disorientation in that vestibular ocular reflex.
Yes, it does.
Yeah, it can be very disruptive to change balance. And
Mm-hmm.
horses go through the same process. Like they'll get a little fumbly footed or they won't be quite as well coordinated during that process of change for the very same reason. They just seem to get through it with less value judgments. And so they do it faster because
I
they're not
wonder though,
labeling
what are they
it.
thinking? I mean, people usually verbalize it,
Yes.
and
Yes.
I wonder what they would say if.
Well, and horses will act out like with resistance to the aids, or they'll get worried, they'll get a little scared. And so knowing what that feels like in our own bodies, we can simplify the work, we can go a little slower, gain some stability in the change for the horse, and then we're pretty good to go.
I think those are really good points to bring up because it happens in us, so it's got to happen for the horses when we're asking them for a change.
Yeah, because the whole
And
proprioception nervous system ways of
mhm,
balancing are really exactly the same as mechanisms in the body. So suddenly we're experiencing internal and managing external forces in a very different way. And that can be disorienting.
yes.
The
And that,
disorientation part doesn't last very long. And what I found for probably both horses and riders is as because proprioception plus the ears and the eyes are really telling us where we are in
yes,
time and space, what we are doing. And so when we disrupt that software program in the nervous system, it can make us feel insecure,
yes.
vulnerable, disoriented, unstable. Nothing, none of those feel good. And
Angry.
angry, that one too. Yes.
The Jack Russells in the group.
Or the rider will look at me and ask for my credentials. And I go, yep, they're feeling it. Why should I listen to you? Right. And so what I've learned to do is go to tap people back into the proprioception that's available in our entire body, skeletally and muscularly, is to go back and forth.
Mhm.
Like to go to the use where your brain says this is right, and then just experiment in this new use that's a challenge to the current software. Right. And what I find that's so fascinating is giving permission to the body, whether we do it for ourselves or for the horses or the instructor tells us to do it. That back and forth is so powerful. And every single body, rider and horse, goes through a couple of moments of confusion where they don't know anymore which one feels better and which one feels worse. They
You
start
can
to get
see it. It's like
confused.
that deer in the headlights look.
Mhm. And the body is a much better tool at finding our relationship to gravity than just our heads. When that back and forth process seems to reconnect the proprioception in the body to the inner ear and the eye perception. And so going back and forth, it's like the inner ear, the eye, and all the proprioceptors in the body start to agree on where the body should be relative to gravity. If we don't experiment, we're just not aware. We can override the body's input as to where we are relative to gravity as we move. But if we do that little back and forth thing, it feels wrong. And so the brain screams, we need the familiar because that's the software,
Mhm.
right? The programmer comes in and says, we're going to do an update, right?
Ah!
It's like the tech guy shows up and it's like, oh, don't mess with my computer. I know how everything works. Or every update we get is so
There you go.
frustrating, right?
There's all those patterns in there.
Yeah, because we just learned how everything works. And then even though the update ultimately makes using our computer easier, at first it's aggravating and frustrating and because we don't know exactly how everything works and can be disorienting. So that's our nervous system is the computer. So I call it sort of a rebooting, right? Or
Mhm.
an updating. And what's fascinating is bodies. I consider humans a little slower than horses, but within 10 minutes minimum, 30 minutes maximum, the whole nervous system reboots to better
Mhm.
balance. I go, that's incredible to me that our proprioception and nervous system can adapt that fast.
Well, if you think about it on the other side, at the beginning, when we were talking about when you have an injury, that it immediately reroutes things.
That's yes, that's the
So,
proprioception of the body. It shuts off the proprioception of that body part,
right.
right?
So it's just, are we in a place ourselves to accept that? Because, like you said, with horses, it's much quicker than with a
Right,
human.
right. And humans become very unwilling to change just by nature. Predators are less adaptable than prey animals. Horses as prey animals are highly adaptable as a survival mechanism, and humans are primarily not adaptable as a survival mechanism. So therein lies a lot of the rub. But when we
Yes.
work with mechanics and forces and understand how the nervous system plays into our sense of balance, we can go through small changes in comfortable ways that are always moving the body towards a better, healthier mechanical use.
I agree.
Yeah. And it's so interesting, our perception of that too, because I remember going to an Alexander technique workshop. And one of the first things that came up in this circle was how naturally animals figure out balance and how
I remember
humans,
that.
we sit in desks and sit in chairs in school, and we've lost that innate ability to perceive our balance in a mechanically sound way. And then everybody looked at me as the token animal person. Like, horses just move naturally, right? The rider has to learn how to balance. And I'm like, not so much. Not so much. Like
Not so much.
maybe dogs and cats, but I go, all bodies can be trained to consciously build a better software program for running the mechanism. All bodies benefit from that. And I think horses, as soon as a rider sits on them on their very first ride, it throws that entire sense of balance and stability off because it's not just their body anymore.
It's a big question mark. Yeah.
Yeah. So
How do I manage this force?
right. So just like riders, the first act of learning to ride is to manage to not fall off. But that doesn't make you a great rider, or it doesn't make you functionally optimal, right? And it's the same for a horse. A green horse can learn how to walk, trot, canter, turn left, turn right, and not fall over with a rider on. But they can do that with severe mechanical dysfunction. So over time, it leads to poor movement, behavioral issues, or wear and tear that can result in lameness or a propensity to injury. It's all the same thing. So it's so fascinating because pulling together body mechanics, forces of motion, and our perception of that, because the perception is everything.
It's key.
It's really key. And to know that even our perception of how we use ourselves in balance is nothing more than a software program in our nervous system that can be changed.
And you know what's real helpful is with some clients using a mirror or taking a picture.
Oh, the pictures are eye-opening.
And they'll go, am I really doing that? It's like,
yes.
Yeah.
No, I just did that. My sister was visiting and she's having sciatica pain. And so I helped her just walk around the kitchen a little differently to relieve the sciatica pain, but she felt so distorted in her movement. It was awkward, it was distorted. And I go, yeah, but is the pain gone? She goes, yeah, the pain's gone, but I can't walk like this.
Why not?
Right. And then I took pictures
because that's
of
that
her.
little thing in her head going.
No, but I just grabbed my phone and took pictures of her where she was feeling sort of like Quasimodo and she was feeling like a hunchback. It was just a softening through her chest and shoulders where she was used to a certain amount of tension there.
Right.
We let that go, and that affected her sciatic nerve, how it balanced her spine, her pelvis, and influenced the sciatic nerve. But I had to take pictures of her to show her it doesn't look as bad as it feels. Right? Because
it's so slight. It can be so slight.
So slight, but it feels huge because of our internal perceptions of balance related to our eyes, inner ears, and all those proprioceptors in the nervous system throughout our body. So it's a big deal.
Yes.
So playing with mechanics and a mirror is helpful, or pictures, because what it feels like and what it looks like can be a bit shocking.
Yes, it can.
Yeah. So biomechanics and the laws of motion, the two interchange. Yes. And that's the last point I want to make is we have this biomechanical structure, which we've talked about. We have certain laws of motion that apply to bodies as much as they apply to cars or airplanes or rockets. And then we have kinesia or proprioception, or the vestibular optical reflex, which is a connection of the inner ear and the eyes, to tell us how our balance is.
Mhm.
But what's amazing with the proprioception too is I think that's the mechanism that also allows all bodies to recognize better mechanical use.
Yeah,
Because
if we bring it to a conscious level, it's
if we
real
bring it
important.
to a conscious awareness, as soon as we are in a better mechanical function with our body, there's a sense of ease, a new sense of stability, maybe coupled with more mobility rather than less muscular tension, which at first can make us feel unstable. But those same proprioceptors tell us the moments we get closer to better mechanical function or better organization of the forces of motion because we feel the ease. Everybody describes it. It's
Yes.
easier, it's lighter. I feel like I'm floating. I feel like, just I can move better, or I'm not as stressed, or literally the wrinkles sort of disappear
Yep.
from the face. So, sort of understanding and tapping into how our nervous system is related to mechanics and forces of motion is fascinating. And it's
Yes.
the essence of a body in motion.
Yes.
Like we could take a horse, a rider, an older person, a younger person, any animal, walking the dog, cooking dinner, any activity, and we're just bodies in motion. So I love breaking it down to like sort of the deepest essence of it, of what we all have in common, because it gives us actually more choice.
Hmm. And that you can change the program.
Yeah. Yeah. Knowing it's going to hurt. There's going to be a
Gonna
small window of discomfort
gonna
when you
have
change that
smoke coming
program.
out the top of your head.
Yes. Yes, yes, yes.
But it's worth it.
But the software updates are available to all of us at any age,
Yes.
which is a great thing to know too.
Yes.
All right, my dear, I think we will wrap it up there.
Okay.
And thank you guys for joining us on this podcast. Please like, subscribe, make comments, share anything you like with us. Happy to have input. Thanks again for joining us, and we will see you next week.
Bye-bye. Be kind, everyone.